Well, here he is, the man himself, and I've been looking forward to this conversation. A very big welcome to you, Dr. Joe Luciani.
Well, thank you so much, Mike. It's my pleasure to be here.
What an ideal, perfect guest to have on the Comeback Coach podcast, a doctor, a practicing clinical psychologist for over 40 years and the best-selling author of the self-coaching series of books. You've been interviewed and published everywhere online and offline on the topic of anxiety and depression, and talk about dovetail really from people who are perhaps coming back from setbacks, adversity, and getting life back on track. So many questions I have, but first of all, can we just have a little bit of an insight, Dr. Joe, into where did you grow up as a boy, and what was life like for you as a boy growing up?
Okay, I grew up in a little town at the time. It's no longer little. It's called Fort Lee, New Jersey, and it's on the Jersey side of the George Washington Bridge. It was mostly an Italian neighborhood, at least the few blocks I grew up on. And there was some prejudice. There was some hard times growing up. Italians were still assimilating into this kind of more Irish kind of neighborhood. So those were formative years. The reason I bring that up is not because it was that significant, but it did shape me in one way. I grew up with a feeling that maybe I wasn't who I was. I wasn't somebody. And for a long time, that haunted me growing up and into my teens, that I had to prove that I really was worth something, that I really was a somebody. So there were a lot of driving forces, but without getting into all the details of my sordid past, I grew up with some anxieties, which was the reason I got into psychology in the first place. Met my wife in high school, and in 20 days, we will be celebrating our 50th anniversary. So I've had a blessed life, 2 wonderful children, and I look back and I just say that I just can't feel that someone had their thumb on the good luck scale when I was born, because I came through it quite well.
Well, congratulations to you and Mrs. Luciani for 50 years of that's something, and that's certainly something to celebrate, and 2 wonderful healthy kids, I presume. You know, you mentioned you won't go into all the sort of details, and we won't, and yet some of the sort of details that people I find connect with, and so that's why I normally start an interview like this with all guests, just some kind of a picture of where's this person coming from, how can I relate to this doctor, this expert, this guru, whoever the guest is. In this case, it's Dr. Joe Luciani, and that's why we go back there. But let's skip forward in life then. You mentioned that, because I can frame it this way, and correct me if I've got it wrong, but you've had a comeback of sorts in your own life by virtue of when you were early in your days of studying psychology, and you thought what you should do is become a patient of psychology, a client of psychology, visit a psychologist, and experience that from the other side. And you've got a story to tell about that. What is it?
I do. Preface that just with a little bit. My mother, God bless her, was a loving mother, but she was a controlling person, and she wanted all those ducks in a row. And I kind of grew up feeling I had to watch all my P's and Q's, and I started to become more and more compulsive, controlling, and I needed to have everything just so. That started to stress me, and it led to some anxieties. I graduated, I went into psychology to find answers to those anxieties. I didn't want to be anxious. I was not depressed, but I was more anxious, and it was interfering with my life. So graduating with a bachelor's degree in psychology, I didn't have the answers. So I decided that, well, where do the answers come from? And obviously at 1971 or 70, the gold standard was Freudian analysis. So I found me a Freudian analyst, and thank God my wife was teaching at the time, because he wanted to see me 5 days a week, and I managed to go 1 day a week. But he never said anything. He was a true dyed-in-the-wool Freudian. He just sat there and And how do you feel about that? And I just could never get him to say, well, if I asked him, well, what do you think? He said, well, how do you feel? So this went on for a while. And the interesting thing was that I had a dream once. There was a little bug on the back of my knee, the back of my leg behind the knee. And he said, looks like you want to be intimate with your mother. And I said, what? What is it? So anyhow, so I came to a point where I got accepted to graduate school to a wonderful school out in California, and I just couldn't not go. I still needed my answers. I loved psychology. It meant everything to me. My wife and I both agreed the move was important. My analyst, however, did not agree. He felt that if I went, not in so many words, but he said my head would explode. There was no way I could handle my anxieties. They would all resurface and blow me away. Well, the desire to become a psychologist was so strong, I rolled the dice and I went out to California. For about 6 months, it was like I walked around with a time bomb in my head that was about to go off. It was horrible because, your therapist, especially when you're a young guy in your early 20s, when your therapist tells you you can't do something, it weighs very heavily on you. I got a letter from him about 6 months into my program out in California, and he wrote a letter saying that his analyst told him that he had to write to me to apologize for his counter-transference because he didn't want me to leave him.
Right.
So we have an expression here in New Jersey. If I ever run into him on the street, it would be a Jersey thing. I wouldn't want to see him.
Yeah. I think I might have seen that same therapist at some stage in my own past. Well, that's interesting, very interesting. So there's an early experience for you from the patient side, the client side.
Yes.
What impact did that have on your future dealing with clients and patients, by the way?
Well, let me tell you, it ultimately influenced the direction of what I write about. But initially, it bothered me, but I went to the first professional school in the country out in California. It was founded by the American Psychological Association, and it required both therapy, individual and group analysis every year for the 3 years I was there. So that's where I really got straightened out. But the Freudian analysis left me with a sour taste. It was just too reflective, too passive, never solved the darn problem. Yeah. And so I started to go towards Carl Jung, who is another traditional analyst, but much more stimulating, just a fantastic journey into all of this, complexities of the psyche. But didn't help my patients. By that time, I was seeing patients, and I wasn't getting the results. It was wonderful. We were talking about transference and the collective unconscious and dreams. People loved it. It was stimulating and hopeful, but it wasn't solving problems. And I'm an impatient guy. So I just started to just say, you know what? One day I had a cousin who was really hurting and a lot of anxieties, 5 medications. And he used to call me Joey Boy because he was younger than me growing up. And he said, Joey Boy, you got to help me. You got to help me. And I said, well, you're my family. I can't help you. I was very rigid at that time. Now I'd see him in a heartbeat. But he came to me, not as a paying client, but as a cousin. But with him, I was able to relax. And that made the difference. I didn't have to sit back and be the therapist, the psychologist, and be formal. And I really took the gloves off, and I was in his face. And I said, what's going on here? And when he, more like a coach, and that's where the whole coaching came from.
Right.
Because I was coaching him. He was an old football player, and I said, if you were on your team, and your coach wanted you to get in the game, you wouldn't sit there shaking, saying, I don't think I can. I'm too doubtful. You'd darn well get off that bench and you get in the game. So I became more fired up. I became more active, more interactive. And I started to go from my place of intuition rather than what I got from a book or any other experience. And I just developed the Joe Luciani form of what I call now self-coaching.
Wow, it's wonderful. And how did your cousin get on after that, by the way?
He moved to Florida, has a most gorgeous home you've ever seen. I won't mention the name of where he lives, but it's he's got 2 lovely daughters, been married now gee, must be at least 40 years, 30 years, 35 years. And he really did quite well. I get a call from him occasionally, and we call those kind of lube and oil calls, where he calls just to get recertify his focus. But we talk at least twice a month, and he's doing quite well. So the thing is that if you are looking for a therapist, a guru, a shaman, or anyone else to heal your problems, forget about it.
Yeah.
Unless someone convinces you that what you need has to come from you, you're wasting your time. You need to be able to have the tools, and you need to have the insight, but you need to realize you've got to do your own work. If you're willing to do that, and if you're willing to work hard at it, then, as I say to my patients, it ain't rocket science. It really is straightforward. Once you understand the simple dynamics of what's going on with anxiety and depression and other emotional struggles.
How very refreshing for our viewers and listeners, Dr. Joe, to hear you say that. And I'm just reminded of a book written by Pam Jung last century on the topic of hypnosis, and the title, her phrase, all hypnosis is self-hypnosis. And kind of it reminds me of what you've just said then. So before we get into some maybe a pointer or two that you may be able to offer generically, because you don't know who's listening, we don't know who's watching, but it's very likely, because it's the Comeback Coach podcast, that the person who is watching or listening to you, Dr. Joe, is somebody who may be going through a state or a phase of anxiety and or depression, and they're going to be hanging perhaps on every word. And so we're going to get into that. But first of all, you are the best-selling author of the self-coaching hyphen in between series of books, and your latest book, and I want to get the title right, even though I've got the book myself, but I don't have it at hand. Unlearning Anxiety and Depression. There's a subtitle to it, but that's the title, Unlearning Anxiety and Depression, published last year, 2020. And I do know that, Dr. Joe, people who want to know more about you, your work, your philosophies, your thoughts on self-coaching, on anxiety and depression, can visit you at simply by going to selfcoaching.net. There's no hyphen there. It's just all one word, selfcoaching.net. What you'll see, by the way, to the viewer, to the listener, Dr. Joe, is 3 quite wonderful affirmations or statements that you have on your website there. And if I may just quote them, life's fences can hold you back unless you fly over them. I love it. Have wings, fly. If you believe you can do it, you can. That's kind of like a well-trodden type of statement, and I can imagine a bit of kickback to that. Oh, I've heard all that before. Easy for you to say, not so easy for me. I'd like to hear something about that from you. And thirdly, don't wait to be happy. Choose to be hip. Choose to be happy. Make a choice. So don't by chance have a copy of your book there at hand that you can hold it up to you.
I can get it off the shelf.
Please do, Dr. Joe.
Thank goodness I put on my pants today.
I should have. There it is. Thank you for that. Unlearning Anxiety and Depression, the 4-step self-coaching program to reclaim your life. Thank you for that, Dr. Joe. And I heartily recommend this book. I've got it myself. I've read through it, and it's I use that term refreshing again. It's quite there's some humour in it too, which I like, and there's some self-effacement in it as well. And so it's a good read, but it's very therapeutic for the person who is going through anxiety and depression. And 4 of the things that the reader and the viewer may see and read in this book is a conversation about the impact of insecurities, the impact of over controlling one's life. And Dr. Joe, you mentioned your own earlier life with your mother, which then transferred, you recognised, into your own habits in life earlier on. Habit loops, I want to come back to that one. Habit loops, mind talk, and here's the kick. Anxiety and depression, is it mental illness or is it a habit? Can you expand on that one for us right now, please, Dr. Joe?
Yeah, I know it's rather heretical for a lot of people to hear anyone say that anxiety or depression may be treated as habits. Let me explain that, because first of all, when you see anxiety and depression as a mental illness, you're in the back seat. What's steering you is this illness. You know, we catch a cold, we catch a virus, we get tetanus if we step on a rusty nail. So when you get an illness, it puts you in the back seat. That always bothered me, because the passivity of being a victim, and by definition, victims are helpless. And I said, no, we're not helpless. How do we get in the front seat and steer our lives? What I started to glean through my years of practice is that if you treat anxiety and depression as a habit, then you're either feeding it or starving it. And that's where the title of the book comes from, Unlearning, because we learn to develop this habit, and we'll get into habit loops of anxiety or depression. Now, how does that happen? Well, it begins with insecurity. We all have insecurity. It's just ubiquitous. It's part of our human species. We don't grow up in a perfect world. No one has perfect parents. We all suffer loss, separation, all that kind of stuff. So we all have some insecurity. Insecurity makes us feel vulnerable. So what does the human being do? We are geared towards survival. So when we feel vulnerable, we do what we need to do to protect ourselves. Now, when we feel anxious or insecure, what we do is we try to develop strategies to protect us. What are those strategies? I call them controlling strategies. We try to take charge of a world that we feel is somehow cascading out of control, whether it be with just anxious, worrisome thoughts, whether it be with panic, whether it be with depression. But we start to say, well, what can I do about this? Now, one of the controlling strategies, perhaps the most ubiquitous, is worrying. Everyone knows about worrying. I mean, there's some normal worrying, but most of the worrying that gets us in trouble is the worrying that's kind of driven by insecurity. That's the ruminative, exaggerated, and worrying creates stress. All the controlling strategies, whether it's compulsivity or worrying, they all create stress. And what stress does to the physiology is that it depletes chemistry. So a habit of anxiety, of insecurity, and an over-controlling lifestyle where we stress ourselves to keep all those ducks in a row and to never let our world drift far from that control requires a great deal of stress and diligence and attention that stresses us and stresses us. So drip by drip by drip, we're depleting the neurotransmitters that keep us balanced. We get to a point, think of a bucket. The bucket comes naturally filled with those neurotransmitters, dopamine, serotonin, norepinephrine, and those are our balancing chemicals. And there's a mechanism in our survival bodies called homeostasis. That's what keeps us balanced. In a normal state of affairs, we tend to stress, or a saber-toothed tiger leaps out and we get stressed and we get bummed out. But a few hours later, we come back to balance. That's homeostasis. But if you keep chronically, if you poke holes in the bottom of that bucket, and if you keep chronically draining that bucket, what happens over time? The homeostatic processes cannot rebalance. So we are now experiencing clinical anxiety, clinical depression. Excuse me.
Yeah.
So I think it's very important to understand that once you treat anxiety and depression as habits, you're in the driver's seat. What does that mean? Well, it means I have a choice. Am I feeding it? How do I feed anxiety, depression? With crumbs of doubt, fear, and negativity. If I feed it, I suffer. So the choice is yours. Are you conceding? Are you giving in? Are you indulging these thoughts of insecurity? And if so, shame on you. But don't whine and cry about it.
Well, I love that. I do love that tough love approach. Dr. Joe has intellect, experience, academic credentials, and a sense of humor. And that's why I recommend the book. Plus, at the back of the very end of the book, I really liked that there's 40 plus affirmations of kind with explanations. And I love that addition to the book. Very, very good. And Any one of them could be picked out and be turned into a year-long affirmation, day by day. In every way, I'm getting better and better along the MLQA kind of approach. Any one of them, there's 40 there to choose from in the book. Just do us a favour, Dr. Joe, just hold that book up one more time, please.
Sure.
This is the latest book that Dr. Joe is talking about, Unlearning Anxiety and Depression, and the 4-step self-coaching program. Now, here we go. A program for unlearning the habit loops that lead to anxiety and depression. What are these habit loops?
Well, first I should point out that there are 3 aspects to the book. One is coaching. That's the in-your-face motivational aspect. I call it, I call it a kind of a social, not a social science, not a biological science, but a motivational science. We need to encourage.
Yeah.
When I start working with patients, typically they're relatively passive, depending on their expectation of therapy. And we need to motivate. Depression, of course, will require more motivation. Anxiety patients are usually motivated from the get-go. They want to stop suffering. But depressive patients, it takes a little bit. So I found that the motivational aspect of psychology is critical. I need to be at times a coach, a cheerleader, but I need to convince someone that they can fight the good fight. Not that I can answer their questions. And the reason I say I need to convince is and I hope I'm not going too far afield. If so, just drag me back.
Perfect.
But I used to do hypnosis early on, and I studied it in graduate school, and it was cool, and it was kind of a great thing to do. But I found the reason, and I was very successful at it. People would lose the weight. They would stop the smoking. There was evidence based on that.
Right.
The problem I had was that it didn't work that well with anxiety, depression. It worked short term. It wasn't the long-term effect. But why I was successful at hypnosis, I kept saying, what is it that one session has such a profound effect? And then it occurred to me. I was a salesman. Hypnosis, you're getting sleepy, you do all this kind of stuff in the suggestion. And if someone believes it, if someone buys it, they're changed.
Right.
So that kind of stuck in my craw. We've got to get to a point where we're starting to believe we can not only fight the good fight, but get ourselves to a place to be strong enough and tolerant enough and courageous enough to do what we need to do. So there was the motivational science of coaching. Then there's the psychology. More or less, unlearning anxiety and depression is more of a cognitive behavioral type of approach. We deal with reframing thoughts and replacing them with more proper kind of thinking and reflecting. And then there's the neuroplasticity. That's the newest ingredient in my latest book. And that's the fact that we have a plastic mind. Our mind is malleable. Every thought that goes into our mind, one thought may not change your neuroplasticity or the neuronal pathways. But if you repeat that thought, and this is like operant conditioning, over and over and over and over, the cumulative effect of those thoughts begin to establish a neural pathway, i.e. a habit loop. So if I have a habit of negativity, woe is me, I can't stand it, life is so hard, and I keep feeding that and feeding it, then the depression, that habit loop of depression begins to grow. So neuroplasticity tells us that we can actually reshape the anatomy of our brains. And this was very, very pivotal for me in writing this book, because then I realized that if we're going to reshape the physical anatomy of our brains, we need to be diligent, we need to be methodical, we need to be encouraged to do this as you would practice an instrument every single day. If you practice it, you will little by little be literally changing the structure of your brain. And that's why the cure, if you want to use such a medical term, is really the restructuring or the unlearning of these neural pathways and replacing them with more adaptive habits and reflexes.
Let's just say that, so I'm coming from, I was on antidepressants for over 10 years. I'm not on them now. And so I was diagnosed, all right, the label was put on. So let's say a listener or a viewer Dr. Joe, listening to you, watching you now, is under therapy with somebody, a professional, and they're on medication because they were diagnosed, and let's say it's a psychiatrist who has diagnosed, they've done the DSM-5, they diagnosed the depression, they've put them on the antidepressant, whatever brand or style it is, and they're listening to you now and they're thinking, oh, hang on, well, if it's just a habit, then why am I on these pills? I know you address this in the book. What do you say?
Well, I'm glad you bring that up, because it is a critical question, because we don't want to mislead people. When that bucket gets really down near empty, there's a significant need for artificial, if you will, medication support to hold your balance. And I think that I look at medication as a therapy facilitator. So if we use medication to bring about the balance and support necessary to sustain, then the therapy itself can begin to do the work to retrain the mind, the brain. So in order to have the luxury and the focus to retrain our thinking and our behavior and our lives, the medication is oftentimes essential. So I have absolutely no problem with medication, and I welcome it, especially when needed, in order to get to the next phase. Now, what I'm after is the motor. What's behind that which generates the anxiety and depression? That's that insecurity cluster of habit loops. Once we understand the habit loops, that which feeds the depression, the anxiety, that which depletes the chemistry in our brains, once we get at the motor and shut that down, then the homeostatic balance is able to restore, and the need for medication is either reduced or eliminated. So I think it's important for people to be hopeful, to realize that even on medication, there are still gains. You can reduce medication, and in certain cases, you can come off medication. Yeah. But not unless you get at what drives it, because otherwise it's like a rubber band. It just goes and then snaps back. You've got to get to that motor.
Yeah, I understand that, and I'm sure there's somebody listening and watching you now, Dr. Joe, who will understand that as well. It makes perfect sense. What doesn't make sense to everybody who hasn't been diagnosed by a professional as being a depressive or having a major depressive illness is that they wake up some mornings and the day just turns out exactly as they thought it would when they wake up. It's going to be a bad day. It's not because it's cloudy and raining. It's just that's what happens. What do you say to somebody about that? They've got this on-off pattern which they can't control or seemingly can't control.
Yeah, if you don't mind, I kind of need to plug my podcast. I just released it today. My daughter and I do a podcast, and the podcast today is how to have a great day every day. And in the podcast, we talk about it's not possible to have a great day every day, of course. And my daughter, God bless, she's a teacher and a wellness instructor, and she brings such insights into our podcast. And she said, we were talking, I said to her, I played the clip for the song Walk on the Sunny Side of the Street. And I said, Lauren, are you on the sunny side of the street or the shadow side of the street? And she pointed out to me that, Dad, sometimes we can't really control the circumstances that come our way. We have a bad day, we just got a bad news from work or an illness or this. So we can't always control the circumstances that put us in a mood or bring us down. But what we can control are certain moments within that day. And we need to keep coming to those moments, and we need to ride out, the circumstances that are pushing against us. So I really think it's important that we realize that you can't have unrealistic expectations. I work with schizophrenics, manic depressive people. There are some organic issues. Yeah. And again, even with schizophrenia, I'm working currently with paranoid schizophrenics. A few, not a lot. My practice is mostly anxiety, depression, but it is the same dynamic. If you allow yourself to indulge the delusions, if you allow yourself to be passive, now obviously with psychosis, this is a much, much deeper and difficult problem. But nevertheless, the dynamic is the same. I use in the book called Mind Talk. You have to separate yourself from that in you which hurts you. Now, the delusions for a psychotic person are what is coming from a defective part of the mind that is destructive. And whether it's psychosis or whether it's just emotional struggle, if there is a healthy you, a mature, adaptive, healthy you, and then there's perhaps the insecurity-driven, destructive you that would rather over-control life, hold you back from life, put you in this category of feeling defensive. And we need to fight off what's truth and what's untruth about our lives, about our thinking. And you mentioned before, Micah, and I'd like to just reflect on it. You mentioned being labeled depression or anxiety. I really hate labels, you know, that old medical model, because it really influences you. I remember when I first started working with patients way back in 1973, and I was an intern at the time. And when I knew I was assigned a patient that was on medication, I remember saying, "Oh, you know, this is a much different patient than a normal person with anxiety or depression." And it spooked me, because I was labeling them according to their labels and their medication as being different from you and I. Boy, I wish I could go back now and give myself a kick in the keister. But, you know, we're all normal. It's all a continuum. You know, whether it's depression, whether it's anxiety, it's a continuum. There are severe, and then there are mild, and somewhere in between. But we're all on this continuum. So it's not abnormal to be somewhat anxious or depressed. What gets into those categories or those labels, I think, really can condition how you perceive yourself and whether you're willing to fight the good fight. Hey, if I've got a clinical diagnosis of depression, I'm more likely to just say, what's a guy to do? I've got this mental illness. You know?
I love it, and I love talking with you. You've got one of those kind faces. You know, you have been perfectly slotted in the role you're meant to be in, Dr. Joe. You've just got one of those kind faces, and you and your daughter, who you're obviously very proud of, who herself, Lauren, is in the business of wellness, and you've got a podcast. What's the name of the podcast?
It's called Self-Coaching.
And where do people find that if they want to go straight to the podcast?
Well, you can go to all my podcasts on the website. That's selfcoaching.net. And there, just click on podcasts, and it's on all the usual channels: iHeart, iTunes, Google, all those numerous things that us baby boomers are still trying to wrap our heads around. And, you know, it's funny because she's a millennial and I'm a baby boomer, and we often get into what's the millennial view on this, you know, with the phones tick, 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 tick. So we
I can relate. I can relate. I've got two older daughters who are just in the same. Well, is it any wonder that you are the best-selling author of this series of self-coaching books? So while we're talking about your latest book, you've actually got 5, 6 or so other books in the series, and you've just got to put in Dr. Joe Luciani. If you can't remember the side door, you just want to go straight to Google and do it the millennial way and type in his name to Google. It'll all come up. But here we are now. As I say, you look like a therapist. You're the kind of guy I would have liked to have gone and seen when, yeah, you've got the beard. I mean, I tell you what, does that come off at night, by the way? Is there glue required?
My kids have asked me, what do you look like without that beard? I've had it since 1971 and has never taken it off since. But at 71, I looked too young. So I figured I had to look a little more mature, but it never went away.
Oh, look, don't lose it, mate. Don't lose it. It suits the whole persona. Look, Dr. Joe Luciani is a clinical psychologist. He's a person before that, and he had his own experience of anxiety, and he writes about this in the book. He was sitting in the dentist's chair about to have a root canal, and he caught himself in a state of anxiety. Can you just reflect on that story for us before we finish up?
Yeah, but I have to preface that by saying I had a very traumatic childhood with a dentist. I had all my baby teeth were pulled out simultaneously without anesthesia because of sulfa drugs I had taken. Why they didn't give me anesthesia, they told my parents I didn't need it. But anyway, I had a very, very traumatic experience at a young age. So I had a really difficult time with dentists.
Right.
So the reflex, the neural pathway was set.
Yeah.
So it took me a long while. And even to this day, if I go to a dentist, I have to keep my head in the game, because the reflex is to tense up. And I'll find myself, they'll be doing, and you've mentioned the root canal, that one procedure, and the old reflex. And I talk about the child reflex. We have reflexes that are very primitive. They come from way back, and they're the hardest to extinguish, but nevertheless. So because of my own work, of course, I realized that, wait a second, let's do what I call a mind check. Where's my head at right now? Where's my body at? And I'm looking at myself, and I actually felt about an inch, my back about an inch off the dental chair in tension. So I consciously took a breath and just physically let go of that tension, eradicated those reflexive thoughts. See, reflexive thoughts come just from underneath the surface. So we're not always conscious of them until we make ourselves conscious. Once I did that, then I forced myself to just lie back, because basically, it's that old reflex of anticipating certain pains or problems. So we really do have to unlearn a lot of the neural habits of the past, and it's certainly doable. The reason it's doable, we know this from behavioral psychology, is that any habit, of course, if it's reinforced, will persist. If it's disused or ignored, eventually it diminishes on a physiological, anatomical level, and especially if it's replaced by a more adaptive learning and habit.
Well, what a pleasure this has been. I have so much been looking forward to talking this conversation with you, Dr. Joe, and being a fellow baby boomer, I get starstruck just at the thought of talking with anyone who has a published book. So Dr. Joe Luciani, if you would please just hold that book up one more time for our audience.
And while I hold that, I'm sorry, while I hold, go ahead, you first, Mike.
No, please, go ahead.
While I hold that up, in our podcast, I said to my daughter, baby boomers are inherently wise, and they possess wisdom. And she goes, Dad, that doesn't matter. We have Google.
Yes.
So, touche.
Google, and when all else fails, go to Wikipedia. Yeah, there's the book. And selfcoaching.net is where you go, or if you're a millennial, just go to Google and do what you do. You'll find him there. And it's Dr. Luciani, Dr. Joe Luciani, Lucia. Well, it'll all be in the show notes. So I'll put all the links. You've got a YouTube channel with over 40. I haven't watched them all, confession, but I've watched some.
I'll send the popcorn.
Yes, there's some. So, and what's the parting? You've got those three affirmations. Life's fences can hold you back unless you fly over them. The second one, if you believe you can do it, you can. And thirdly, don't wait to be happy, choose to be. What would be a parting thought, a parting message for the viewer or the listener right now?
If I could think of anything that would be a parting thought, it would be that once you're behind the wheel, the destiny of your life was never meant to suffer. That's not why you were here. It never was supposed to be that way. If you are struggling in life, that's an overlay on your pristine, sacrosanct personality, the person you were meant to be. In order to liberate yourself, you do need to find those tools, but you can do this. You aren't meant to suffer. You deserve to have the life you want, and the life you deserve is the life that you'll get.
Wonderful. Thank you. And to you, the viewer, the listener, you've been watching or listening to the replay of this conversation on the Comeback Coach podcast with clinical psychologist Dr. Joe Luciani, who we are very happy and grateful that he could make his time available and talk about anxiety and depression and his new book. Until next time, this is Mike Searles signing off.